Hey guys, Dr. Morris here. So I wanted to talk about a video that dropped yesterday and elaborate a little bit more of my thoughts as it pertains to specifically about stem cells and the difference between getting them here in the United States and getting them in other countries like Panama, Mexico, Colombia, and so on and so forth. So one of the Philadelphia Eagles yesterday posted a video that he went to BioAccelerator in Colombia and was excited about getting his rehab, and it looked like more of a promotional video for them than it was, discussing his journey. Now, I've had multiple NFL guys I've spoken with in the past talk about all these different companies in different countries, and I want to set this record straight as to why they might go there and why they should consider not going there. So here's what is important. Most people think stem cells are illegal in the United States, and that is false. First off, if you look at this bill right here that was released in last July 2025, specifically in the state of Florida, it says that they are available, and although not FDA approved, they are okay to be used and injected assuming the source is correct and safe and properly vetted. Now, we've been doing stem cells for over 10, 15 years here at the Osteopathic Center, and many places around the country have been doing this as well. The difference was, up until last year, we couldn't talk about it. We couldn't advertise it. After this bill came out, specifically in Florida, Washington State is the other state that I'm aware of, you can now actually advertise for it. Now, what is the difference in product type, in safety, and injection style in the United States versus somewhere, say, Colombia, Panama, Mexico, so on and so forth? Well, before I even go to that level, there is a significant safety issue that needs to be discussed in the United States versus in these other countries. Now, flying to Colombia, flying to Panama, flying to Mexico, or driving across the border to Mexico, depending on where you're at, is risky in its own right. Right? Assuming that you don't speak Spanish, assuming that you aren't from there, you already have a level of risk that you're entertaining. Right? Now, if you're a big 250, 350 pound NFL lineman, probably not a big concern. But if you're a mere mortal like the rest of us, that is something you need to be taken into consideration. The cartels don't care, and they will see you and say, he looks like he's here for money. He looks like he's here for procedure. Let's consider kidnapping him. Something to think about. Secondly, these companies, these countries do not have the FDA to oversee them. While we like to, bash on the FDA, that is not something that's always a bad thing. They do a lot of important things that are responsible for stabilizing, preventing, and protecting us. Yes, they have their own fair share of issues, but one of the important things to understand is that the reason why we can't do certain things here is because they're not safe. That theory and statement does not apply when you are in a different country. They can do whatever they want, and there's no one to say otherwise. The last and most important thing that I want to discuss here is twofold. One, the type of products that they use versus the type of products we use, and two, the volume and style of technique of injection. Now, here in America, we can do pretty much anything except culture expand, something called placental MSCs. Basically what that means is that we can take your fat out, has beautiful stem cells. We can take your bone marrow out, beautiful stem cells. They get a little older as we get older, but still. PRP from your blood doesn't technically have stem cells, but it helps. You can take amniotic or connective tissue out. That's one of my favorites. Yes, that is safe. Yes, that is legal. You can also take out exosomes, which are the growth factors inside of the stem cells. All of those are legal. All of those we've been dealing with them for many years. The only thing we can't do is take a placental-based stem cell, actually put them in a lab and multiply them. Say you get 10 million, then you want to multiply them times to 10 to get 100 million. The problem with that is that every time you multiply a cell, it becomes more unstable. When we get more unstable, we have a risk of transformation, of becoming something that it is currently not. And the data shows after 5 rounds, that's where the risk implies. So every time they multiply that, that cell becomes more unstable. Now, what does that mean? It could mean a lot of things. Every time they multiply that to get more, and remember, these are expensive to source. So if you only have 100 million and you want to make a billion or 20 billion, you're going to multiply. Well, if that cell becomes unstable after 5 rounds, and they're doing 5 to 10 rounds on each sample, there's a lot of risk involved. Could that become cancer? It's possible. Good luck trying to prove it, but it's very possible. Can you hold them accountable? Maybe, probably not. And the question is, now, what do you do about sourcing and about sampling? Are they coming from clean, legit sources? Are they paying off a blood bank or a tissue bank or a cartel or someone to say, hey, we need X amount of samples from placenta, give us this regular stream? That's not possible in the United States because everything has to be done through a tissue bank. Not applicable in other countries. They can do whatever they want. Now, I will give them one thing. They are very good at marketing. They are very good at marketing. They show you this pretty thing. I'm going to pick you up in a limo. You get morning breakfast. They probably entertain you with women. Works well for the guys. But at the end of the day, this is about safety. This is about expertise. And this is about putting something in your body that is never going to be able to be removed. Sound familiar from maybe 5 or 6 years ago? That's part of the concern here. You don't know what you don't know. The last thing I want to talk about is specific technique. Now, what you'll understand and what you'll see at a lot of these places, whether it's Colombia, Panama, Mexico, in the Caribbean, wherever, is that these guys are not super high level skilled. What I mean by that is if you want to put it into the knee, say you put it directly into the joint, maybe you have a couple different injuries. Well, realistically, there's about 15 to 20 different areas in the knee that you can technically inject depending on the individual patient. The problem is these guys, these physicians, traditionally don't have the same skill set that we do. So they're going to put it in 1, 2, maybe 3 spots and hope the product magically finds the injury. They'll also put in 10 to 50 to 100 million IV stem cells, and you will feel a rush of euphoria. You'll have a lot of growth factors and a lot of decreased inflammation, but they're not going to fix the problem because you didn't put the needle where the problem was. And I speak from experience because I have several patients that have went down there, that had complicated injuries, and they still have them after they came back many months later because they didn't know where to put the needle. This is a highly skilled process. This is not a cortisone injection. The final thing that you have to understand is they have the luxury of not worrying about the FDA, not worrying about big pharma, not worrying about big insurance, not worrying about malpractice. So what does that mean? Cheaper for you. At the end of the day, you get what you pay for. That's all I have to tell you. I have never seen, I go to 5 to 10 stem cell conferences a year. I was just at one 2 weeks ago speaking. I've never met someone from any of these companies speaking at one of these stem cell conferences. If you are a leader in your field, a leader in your industry, don't you think they would be lecturing at these conferences to people that only want to hear about stem cells? Something to think about. Hopefully this was helpful. There's your difference between stem cells available in the United States and stem cells available in the rest of the world.